How do pre-op nurses ensure patient safety for plastic surgery? Imagine stepping into a clinic for a plastic surgery procedure. Before the surgeon even makes the first cut, a dedicated pre-op nurse is working behind the scenes to keep everything safe and smooth. Their role is vital in making sure every patient is ready physically and mentally for surgery. They start by reviewing the patient's medical history thoroughly. This includes checking for allergies, current medications, past surgeries, and any health conditions like blood clotting issues or heart problems. Recognizing these factors helps the team plan the safest approach and decide if any precautions are needed or if surgery should be postponed. Next, they focus on patient education. The nurse explains what the surgery involves, including potential benefits and risks, so patients understand what to expect. They review the informed consent process, making sure patients are aware of the procedure details, recovery process, and possible complications. Clear communication helps patients make confident, informed decisions and sets realistic expectations, which is key for satisfaction and safety. Pre-op nurses also give detailed instructions for preparing for surgery. This includes guidelines on fasting, usually for at least 8 hours before the procedure, to reduce anesthesia risks. They advise on medication management, such as stopping blood thinners or certain supplements as directed, and emphasize hygiene practices like showering with antiseptic soap to lower infection risk. Patients are also counseled to avoid smoking and alcohol, as these can impair healing and increase complications. Assessing psychological readiness is another crucial step. The nurse looks for signs of unrealistic expectations, body image concerns, or emotional distress that might affect recovery or satisfaction. If needed, they refer patients for counseling or mental health support to ensure emotional well-being before surgery. Coordination with the entire surgical team is essential. The nurse communicates with surgeons, anesthesiologists, and other healthcare providers about the patient's health status and any special considerations. This teamwork helps prevent errors and ensures everyone is on the same page for a safe operation. Infection prevention is a top priority. The nurse verifies that patients have followed preoperative hygiene instructions, such as showering with antiseptic soap. They confirm that any preoperative antibiotics have been given as prescribed, which helps reduce the risk of postoperative infections. Right before surgery, the nurse performs final checks. They confirm the patient's identity, the correct surgical site, and that all necessary paperwork and test results are in place. They also verify that the patient has adhered to fasting instructions to prevent anesthesia complications. Throughout this process, the nurse provides emotional support and reassurance. This helps ease anxiety and builds trust, making the experience less stressful. A calm, well-informed patient is more likely to have a positive surgical experience and better outcomes. In the context of plastic surgery, where patients often have high expectations and elective procedures, the role of the pre-op nurse becomes even more important. They ensure the patient is physically prepared, mentally ready, and that all safety protocols are followed. Their thorough assessment, clear communication, and strict adherence to safety standards help minimize risks and contribute to successful results. Remember, while pre-op nurses do a lot to keep patients safe, their efforts are part of a team approach. Patients should always follow their healthcare provider's instructions and seek personalized advice for their unique needs. Safety in plastic surgery depends on everyone working together to ensure the best possible outcome.